Hi, this is Dr. Danto, and today I will be taking you through a lower body exercise prescription routine. Please find a comfortable seated position on the floor to start. If sitting cross-legged is uncomfortable, then try using a pillow under your buttock or sit on your knees or with your legs out to the side. The exercise prescription involves both stretching and retraining exercises. It is like any other prescription, which means that it should be prescribed by your clinician after an appropriate history and physical examination. Also, like other prescriptions, you must take it as prescribed for it to work. Generally, do the routine 1 to 3 times per day unless otherwise instructed by your physician. The stretches are especially important to do prior to and after exercise. The retraining exercises are especially important to do before exercise because they encourage the correct muscles to contract when they're supposed to do so. If any of the stretches hurt, then don't do them and plan on discussing it and possibly demonstrating it at your next appointment with your clinician. If you are no longer feeling a stretch when performing a stretching exercise, then you may reduce its use as part of your warm-up and warm-down routines or substitute another stretch. You should test your body weekly by performing all the prescribed stretches. Self-testing will allow you to tailor your routine to optimize your program and thrive. Since the mind is settled and focused during the program, we may enter a meditative state, and in so doing, it may be helpful to set an intention. I like to set my intention for strength, flexibility, and focus. Some like peace, harmony, or love, or all three. Your intention may be what you want out of the practice or how you want the energy or flavor of your day to consist. It's up to you. Please bring your hands to heart center and let's take 3 deep breaths in through our mouths and out through our nostrils as we set our intention. We're going to start with the butterfly stretch. With this stretch, we bring the soles of our feet together, and most people bend forward. I actually like to put my hands behind and scooch my pelvis towards my heels, or bring my heels towards my pelvis. We're going to hold this for about 30 seconds. Be nice and tall. Try to keep that standing curve in your lumbar spine or in your low back. Make sure you keep your shoulders down as you're putting your body forward. And relax. Breathe into the posture. And smile. The next exercise we're going to do, or stretch, is we're going to put our leg out to the side. I'm using my left leg and putting my right foot forward. Some people would switch it, whatever you want. And we're going to be tall again through our lumbar spine. As we bring our chest forward, you can go for the heel stretch, but really we just want to feel down the leg or from the foot stretch. I'm not at a heel stretch personally. Keeping my low back straight, keeping my head forward, and just breathe into it. Now we're going to switch sides. Put your other foot forward, and again, touch your foot with your hand, keeping your low back straight as possible. And smile and breathe. You can can also contract your quadriceps muscle, and that gives you another stretch. Do that for 5 seconds and then relax and go a little bit further. You can do that 3 to 5 times on each side. Now we're going to lay on our back, face up. And we're going to grasp behind our right thigh and push our foot towards the ceiling. Pump your toes up and down 10 times. And now we're going to bring our toes back, our heel out, and we're going to kick it out 10 times. And then we're going to pull our leg towards us 10 times. This is a great posterior leg stretch, especially the hamstrings. And it's also a sciatic nerve stretch. So it's really great to stretch out the nerve itself. And then we switch to the other side, repeat it, 10 toe points. Then 10 heel kicks. And then 10 leg flexors. And hold it and relax. Keeping this leg bent, take my other ankle and cross it over my knee and pull my other knee towards me. And in doing so, I've created a great hip opener. Now I keep my foot dorsiflex, which means, again, my toes up and my heel down. You do this for 30 seconds too. Keeping your heel flexed helps to protect your hip. You should feel this as in your hip. It's both a hip opener and a piriformis stretch. We're going to switch sides and do the same thing on the other side. Sometimes it's helpful to rock back and forth, and you get other parts of the piriformis stretched or the hip open where you can rock up and down, but you have to do it gently, and you have to listen to your body. Nice deep breaths. Relax your shoulders. Enjoy the experience. And now we're going to do a hip twist. Put your arms out to your side and let your leg fall over the other leg. And nice deep breaths. Now with this, and you look over your shoulder towards your arm on the side that your leg is from, that you're crossing over. And with doing this, it's a really good stretch of the neck and everything. You can facilitate a rib stretch by pulling on your ribs or your skin on your ribs or on your pectoralis muscle and pushing on the muscle here. And after 30 seconds, we're going to switch it over to the other side. And again, we look over our shoulders. You can decide what feels like a better stretch, keeping your legs pointed or dorsiflexed, your feet pointed or dorsiflexed, toes pointed down or up. And again, I just feel this in my pectoralis, so I'm just facilitating a little bit more by pulling along the fascia of the muscle. And again, at the ribs, taking some deep breaths. In through our mouth, out, or in through our nose, out through our mouth. And just relax and enjoying it. Now come back to the center. Put your feet flat on the floor. And we're gonna cross our, well, one leg over the other and let our legs fall over and put our hands behind our heads. And this is a great Quadratus Laborum stretch, which is a low back stretch. It's very similar to the last stretch, but it's an additional stretch. Then we undo it, come back to the center, put the other leg on top, and go over towards the other side. About 30 seconds or 3 to 5 deep breaths. Come back to the middle. And then we're going to go ahead and twist our body over and come into the hand in knee position. We're going to do cat-cows. And we inhale and allow our backs to sink, our shoulders to draw together and look up at the ceiling. And then exhale and curl under. And inhale. And when I do this, I go from top to bottom and bottom to top. So right now, I'm gonna bring my lower back up and curl up. And inhale and start from the top of my neck and let my body go vertebra by vertebra into extension. And exhale. And inhale. And then come back to the middle. And we're going to go ahead and we're going to come onto our forearms, cross our right forearm over the front and just lean back towards that right side. And this is a great latissimus dorsi, quadratus lumborum, and gluteus medius and minimus retraining, stretch and strengthen. So we're going to hold this for about 30 seconds. Inhale and exhale. Beautiful. You should feel that in your gluteus as you come off to the side and go off to that side. And then we're going to come back to the middle and go the other way. Okay, and we're going to come back to meet me in the middle, and we're going to go down, and we're going to put our hands at shoulder width, a little bit wider than the shoulders, at shoulder height, and we're going to contract our gluteus maximus and our low back and lift the front of our body up. If we take our hands away, we're still here. So our hands are there just as a little bit of support as we lift up. This is called baby cobra. The main thing is to to do it through your back muscles and really activate that core and the muscles of your buttock and your low back and your abdomen. When I take a deep breath, my abdomen is tight enough for it lifts me up. Now we're going to go back to go all the way down. Then we're going to come up into the Sphinx position. And what we're going to do is we're going to take our hand and go 45-degree angle and bend our leg, look over at it, and if we can, we're going to grasp our ankle. Now if you can't get your ankle, that's okay, but we're eventually going to get to the point where you can pull your foot all the way to your buttocks. And we're going to hold that and breathe. 3 deep breaths. All right, and letting you go. Back to Sphinx. Now we're gonna go the other direction. 45 degrees, ankle grasp, looking over our shoulder. You also want to keep your gluteus maximus contracted during this exercise, because we're not just trying to stretch our quadriceps with this, we're actually trying to stretch our hip flexors. Let go, come back to Cobra. We're going to go back down, put our hands back at shoulder height, a little further in shoulder width. We'll go into baby Cobra. And then if you want, you can go ahead and push up by keeping your elbows down. If all you can go is this high, that's fine. If you can go further, that's great. I'm going to go right here. And the most important thing is to keep your shoulders down. You don't want to bring up here like this, you want to bring up just like that. Three to 5 deep breaths. Okay, now I'm going to do hip extensor retraining. And I'm going to turn my head this way. And I'm going to dorsiflex my foot by putting my toes flat on the floor. I'm going to straighten out my knee, and I'm going to lift. And I can put my hand on my gluteus here to feel it lift and extend. The key thing here is we keep our pelvis flat on the floor. We do that 10 times. And we're going to switch to the other side. Again, feeling my gluteus maximus, dorsiflexed, knee extended. Three sets of 10 on each side. 8 to 10, really. Great. And here's our last set. Outstanding. Okay, now we're going to roll on our side with our knees bent. Support our head with our arm. Again, here's our hip pointer, and here's our buttocks. I'm going to put my hands on my buttocks, my finger pads on my buttocks, thumb just near that. And what I'm going to be doing here is doing a little bit of a clam exercise. And what I'm really doing here, So that first few degrees of the clam isn't a rotation of the hip, because I can rotate my hip all the way out to here. That first few degrees is what we call abduction. So it's doing this motion. So we're going to do 10 of these. So here we go. And we want to feel this muscle contract in here. If we're not feeling it contract, give yourself a few pats on your buttock here. And what that does is it activates the muscle, increases the blood flow, increases the nerve supply. And that's 10. And then we're going to do the other side. So I'm going to do the other side by switching over to my head and my feet. You can just roll over. Again, switching over to the other side. I'm going to roll over this time. We just have one more set in each direction to go. Great. Excellent. Now we're going to come up to the seated position. Feet flat on the floor, knees pretty close to 90. They can be further apart, further not as flexed. You want to have your back as straight as you can, okay? And what we're going to do is something called a sit back. And these are abdominal exercises, but because we're keeping our back in this standing lumbar extension position, we can put our hands like this for counterbalance, and what we're going to do is we're going to just sit back like straight back. Now you go as far back as, if you go too far, your feet will come off the floor. So you go right to that feather's edge, and at the same time, you don't want to lose that curvature. So if you're like this, that's not what we want. So again, 10 times, or really 10 to 25 times. Now there's different levels doing sit backs. You can do it keeping your arms straight like this. You can fold your arms for the next level. This is probably my favorite one to do. And then the harder one is to put your arms on either side of your head and go straight back like this. I'll go back to here so I can continue to talk. So this is about 12. So we'll do another 12 or 13. Exhale as you come back and inhale. Exhale. Three more. Great. Now we're going to do sit backs with a twist. So a sit backs with a twist is a more advanced version, and I'll do these again with my hands out, and we're going to twist one way and sit back, and then the other way and sit back. And we'll do 10 to each side. Four, 5, 6, 7, 8, 9, 10. Okay, we're gonna go all the way back down again. And now we're gonna do pelvic tilts. And so we're gonna tilt our pelvis back up towards us, and then we're gonna roll it down the other way. So we flatten our back down here and then arch it. And we do it from below and then from top down. And below and top down. And we got 6 more to go. Vertebra by vertebra. We don't have to lift up yet for a bridge. You're doing great. Now we're going to do a bridge. It's going to be the same way, from below to top, from below to up, and then we're just going to keep going and lifting up. And we can draw our shoulders together, and we can either take a grasp here, and what you do is you're really pushing with your feet so that you're contracting your gluteus maximus, or instead of holding your hands here, you can support yourself through your low back. But the main thing is to contract that gluteus maximus. You can feel your butt contract, but the best thing is to push with your feet straight down. And we're going to do that for another half minute, holding it up in the bridge. And this is a good core exercise for strengthening your gluteals and your back, just like we were doing the leg extensors previously. About 20 more seconds of holding your back like this. Great job, everybody. Progress, not perfection. Body, mind, and spirit. In through the nose, out through the mouth. Relaxing into the posture. And smile. And slowly we come down from the top down, rolling into it. We can pull our knees towards ourselves and just kind of rock back and forth. And slowly bring our feet down for Savasana. Letting our bodies integrate the whole experience. Three deep breaths again. In through the nose, out through the mouth. Letting go, letting God, relaxing our muscles. Where does that breath go? Savasana is that time in which the exercise prescription integrates with everything you've just done. Stretching, strengthening, rebalancing. We're going to bend our knees. Place them flat on the floor. Most often we roll to our right sides. And then push up with our hands. Taking time to appreciate this exercise, this time that we've taken for ourselves to integrate our bodies. And we're going to bring our hands up, bring them together, and bring them back down to heart center. Maybe coming back to our intention for our practice, this exercise prescription. Maybe it was just to be balanced, which is a great way to start. Thank you for joining me. Continue exercising. Every day is an opportunity to be better than yesterday.